let's learn about retinopathy of prematurity. There are areas of the retina that are defined by the anatomy that help us understand ROP. The zone 3, far anterior, the main zone 2, and far posterior zone 1, defined by the distance between the macula and the disc. And the nasal periphery helps determine zone 2 and zone 3. The further back, the more severe the ROP, and the further forward, the more the normal retinal maturity. This shows vasculogenesis, or normal, on the left side, with blindness from ROP occurring because of areas of avascular retina with oxygen stress producing VEGF, or vascular endothelial growth factor, producing angiogenesis and eventually tractional retinal detachment and blindness. Imagine with prematurity, there's an area of avascular retina. If there's unstable respiratory course initially, there is vasoobliteration of the little vessels and even more avascular retina. This leads to the production of avascular retina's vascular endothelial growth factor plus oxygen stress, produces a demarcation line in the vanguard of the advancing retinal vessels, and even more VEGF is produced. This then produces angiogenesis, or abnormal blood vessel growth, and a fibrovascular ridge, plus disease, and some VEGF goes to the front of the eye, producing neovascularization of the iris and subretinal fluid. Vasculogenesis, again, is the normal process that a term baby would have, and the vessels reach the periphery and maturity with no risk of retinopathy of prematurity. With premature birth, however, there is oxygen stress and obliteration of the vessels. As the vessels grow, they get to demarcation, stage 1, a ridge, stage 2, and fibrovascular proliferation with bleeding, retinal elevation, and stage 4, partial retinal detachment. Again, we get stage 1, stage 2, and we get worse. At that point, laser can be delivered to the avascular peripheral retina, which produces changes in pigmentation. Mature retinas that are safe from ROP reach the far peripheral retina, or the ora serrata, and if the vessels grow all the way to there, we have maturity. Another way to protect the retina is the laser brings the periphery to the vessels. This is another way to become safe from ROP. Now imagine a premature retina again, reaches stage 1 and then stage 2, and we inject intravitreal anti-VEGF medications. This rapidly reduces the plus disease and will settle retina down, allowing the blood vessels to grow all the way to the periphery, and a safe result. The vascular endothelial growth factor is blocked by the medication, but the medication only lasts 5 to 8 weeks. Again, imagine a premature retina reaching stage 2, then maybe stage 3, and getting good anti-VEGF injection with improvement, but the avascular retina may then start reproducing more vascular endothelial growth factor. And so babies like this that may have been discharged from the nursery may again develop an active ridge or fibrovascular proliferation, and even stage 4, and hopefully not, but possible stage 5 total retinal detachment and blindness, even after an initially successful anti-VEGF injection. So when is ROP safe? We have to monitor until retinal maturity. This is if all vessels reach the periphery or it can occur if the laser clears the plus disease and reaches the limit of the blood vessels. Active ROP with residual avascular retina requires timely monitoring.